During the last few days, mortality rate in Jammu is increasing, and that's a matter of concern for administration here. This is one of the reasons the three-member team had been here to find out reason. But most of the time, people here are complaining that they are not getting best treatment here in hospitals in Jammu region. Often their complaint is that the senior doctors are not attending them. Few days back, in fact, Commissioner Secretary Health also came out with order where he asked senior doctor to at least make round of wards where the COVID patients are undergoing treatment. Let's speak to Dr. Monika Lange. Her brother was suffering from COVID and she had to face lot many problems. Let's try to find out what kind of a nightmarish experience family had because she feels that they didn't get the proper treatment because of her, which condition of her brother deteriorated. Monika ji, thanks for talking to Times Now. Can you tell us what kind of problems you had to face, your brother had to face when he was diagnosed COVID positive?
Yeah. Pradeep ji, few days back, my elder brother was tested positive and we are managing him at the home. Somehow his condition was deteriorating, his saturation level was fall and it was 85%. My relatives took him to GMC Jammu and in the GMC Jammu, as per the nurse on duty, he said that doctors are having meal and they will attend the patient after having the meal only. My brother's condition was worsening, he was desaturating and after 1 hour of wait, doctor came and said that patient required no admission, take him back to home. Somehow with the help of my contact, I got admitted my brother in Gandhinagar hospital. His saturation was 85% and on 2 liter he was maintaining 93 and 94%. But he was getting treatment in the Gandhinagar hospital which was not sufficient as per his condition. I spoke to the medical superintendent of the hospital that my brother condition as per my brother's condition he requires some good treatment but he said कि हमारे doctors जो treatment दे रहे हैं वो best treatment दे
See,
रहे हैं.
I want to ask you, I want to interrupt you here. Whatever was
Yeah.
written on the prescription, was he getting all those
Yeah.
injections and
Actually,
everything?
nobody show me that paper what he is getting treatment. So somehow I asked my brother कि भैया जो आपको treatment मिलेगा please आज nurse से पूछिएगा कि nobody is telling me what he is getting. तो मुझे उन injections के नाम चाहिए. And he tell me that nurse is giving only 2 injections in a day. That is one was doxycycline and one was dexamethasone. After hearing this, I was very much worried. My brother, on the day he was admitted, he was on 2 liter of oxygen, and the next day he went to 15 liter of oxygen requirement, and he was complaining me, I'm facing the breathing issue, but doctors are not listening. Then I
So
asked
nobody
some other
was
people,
nobody was attending him there.
Yeah. Yes, the doctor who attended him told me that he is fine, your patient is becoming panic only, he's fine, he's doing well. But because I am also an emergency medicine physician, I am attending the patients here, I know the condition of COVID positive patients. 15 liter of oxygen requirement, you know what will be the situation of the patient. Somehow with the help of some of my colleagues, I got the pictures of the treatment. You can't imagine the treatment written on the paper, what they have written and what my brother was getting. The injections which was written by the doctor on that file, that was injection Tazact, IVTDS, injection doxycycline twice a day, dexamethasone, oral medications, and my brother was getting only 2 injections per day. That's the reason which made her condition worsen. Somehow, with the help of my friends and with some relatives, I shifted him to other hospital where he got best treatment, and now
I
he
want to
became
stop
fine.
you. I want to stop you here. I want to tell viewers. See, it's more than shocking because we trust doctors because for us doctors are like God. If they are inside COVID ward, attendants can't go. And we think
Yeah.
that they will be getting the best of treatment. That's what actually Dr. Monika Lange is saying. Whatever was written in medical file, they were not giving those injections to the patient because of which he's saying
Staff is
that
not
condition was
following.
deteriorating. So they are not following actually that prescription, what actually was written there. So आपको क्या लगता है? You ever try to inquire that why those injections were not given?
I don't know. I think staff is not responsible. They are just coming and completing their shifting hours. They don't bother the condition of the patient actually.
You
Maybe
have
the
one
story
because
of
you
my
wrote. I
brother.
saw that
It will
you took to social media space also. You took to social
Yeah.
media space also because you were quite angry after that, because when you shift to your brother from
Yes.
this place to the other hospital, and you wrote one word
Yes.
that you treat, don't teach, cheat. What actually you wanted to convey?
Yes, yes, it's my advice to all the health workers and humble request to all, please give your best, please treat and don't cheat. All doctors and staff should give health and treatment status to the family daily. It's their responsibility. Family को ये लोग update नहीं करते हैं what treatment the patient is getting and why his condition is worsening. A stable patient suddenly deteriorated because he was not getting proper treatment. No investigation was done, no timely medications was given to him. This is a story of my brother. Can you imagine what common people are suffering there? इस टाइम जैसे सोल्जर को बॉर्डर पे जितनी भी रिसोर्सेज हैं जंग लड़ने के लिए, जब वो आगे जाता है तब वो ब्लेम नहीं कर सकता कि मेरे पास ये शस्त्र नहीं है या मेरे पास ये नहीं है तो मैं नहीं जंग लड़ूंगा. वी आर, अगर हमारे पास इस टाइम जो भी रिसोर्सेज हैं हमें उन्हीं को यूज करके अपना बेस्ट देना है. एज अ डॉक्टर माय एडवाइस टू द हेल्थ वर्कर्स, प्लीज गिव योर बेस्ट, treat the patient and please don't cheat. If you're on duty, please give your best. This is the story of my family. ऐसे बहुत सारे लोग होंगे जो जम्मू में अभी सफर कर रहे हैं.
So
Please
very,
don't
very
give
strong,
in to
very
others.
strong message from her side. She said that she knew lot many people, despite that she had to face so many problems. That her message is that don't cheat but treat. And she's trying to compare doctor right now with soldier. The way the soldiers are fighting on the border, they don't complain
Yeah.
that they are not having this weapon, they are not having that arm and ammunition. So they are fighting. But the only difference is that these doctors are right now fighting with invisible enemy. So what she is trying to tell them, you give your 100%, give your shat pratishat. That's what is required, because everybody is looking towards you. You are like God to them. So when you are seen as God in apron, so you also try to be like one. That humanitarian gesture of yours can really make difference and save lot many lives. If today people are losing their lives, it is somewhere because either the infrastructure is not available, or maybe sometimes it's because of the negligence of the doctors also. So she wants that at least doctors should give their 100%, because she had also herself been 24/7 performing the duty. Despite being detected COVID positive, she came back, started serving her own people. She wants that each and every doctor should do that. We are not blaming medical fraternity, but yes, there are some people who are not performing their duty well. It's because of them the whole fraternity gets bad name. Pradeep Datta with Amit Bhardwaj for Times Now.